What was the idea of this study? There are no comparative studies comparing thalidomide versus Revlimid in combination with a strong backbone. We used Carfilzomib Dex, so we compared Carfilzomib thalidomide Dex with Carfilzomib Revlimid Dex. And people have some, let's say, reservations regarding thalidomide, but our data show that in elderly patients, the combination Carfilzomib-thalidomide Dex was at least as efficacious as the one with Revlimid. And what we found in our study, that the Revlimid is not such a, let's say, well-tolerated drug in very elderly patients, because when you treat your patients, after the first months after the first cycle, patients have some elderly patients have some cognitive problems, so neurocognitive problems. They recover thereafter. So that is something which has not been described before. And then patients had 9 cycles of these 2 induction regimens, and then were scheduled for maintenance therapy, either with Carfilzomib alone, or they were randomized to an observation group. And there we found something which was completely new to us, because there was a median interval of about 6 weeks between end of induction and start of maintenance treatment. But the patients who were randomized to Carfilzomib maintenance, just by knowing that they had to continue chemotherapy, had a worse quality of life. So the perception that something is coming which is continuing what you had before, which is somewhat cumbersome, reduced the quality of life. So in contrary, the patients who were randomized to the observation group enjoyed a better quality of life after this interval of 4 to 6 weeks. So that is something which should be known. And in the end, in elderly patients, Carfilzomib maintenance has no significant impact on quality of life. But when you look very carefully, it's not a treatment which patients would favor unless there's a significant survival benefit, which unfortunately was not found.